Okay, good morning or good afternoon, everyone, wherever you are. My name is Prashant Kumar, and I'm a professor and chair in Air Quality and Health and the founding director of the Global Center for Clean Air Research, which is based within the Department of Civil and Environmental Engineering. So welcome to this fourth webinar in the series of the Global Indoor Air Quality and Respiratory Infection. We have our colleagues from Ethiopia and Nigeria today. But just to give a little bit of introduction to this webinar series. So it's a project which is supported by the University of Surrey and the EPSRC. So it's called KTP-IAQ, which is Knowledge Transfer and Practical Application of Research on Indoor Air Quality. It's a knowledge exchange platform across the ODA countries with the aim to share and discuss the state-of-the-art best practices on indoor air quality and respiratory infection. So we have 12 ODA countries, which brings 13 different cities, and each ODA country has got a the PI and involving over 40 ECRs, which is the early career researchers in the form of MSc students, master's students, the PhD students, or the postdoctoral researchers. These are the kind of countries we have got involved in this activity. So they come from the different regions. So for example, in Latin America, we got Brazil and Colombia. We have then the Middle East, where we have Kurdistan in Iraq, as well as Egypt. And we got then the Southeast Asia, where we got Bangladesh, India, China, the involved in there, as well as the 4 of the countries in Africa. So we got 2 of them represented today by our speakers, and the other 2 you will be hearing, in the next webinars. So this basically is the franchisee of the clean air engineering, the project which we started in 2019. So the first one was clean air engineering for cities, where we were focusing on the in-car aerosol exposure. So we had a series of studies being done in different cities. So all of these, the colleagues who participated, they run their DIY kind of, the studies in the cities. So you can see the 2 publications there. And then we got a follow-up project, which is called another franchise project called Clean Air Engineering for Homes. So here we were focusing on the in-kitchen aerosol exposure. So over the last many months, we have been doing all this monitoring, and they can see this paper what they submitted today. So there is all our collaborators and the number of these the ECRs involved in there. So hopefully it will come, if it gets accepted, it will come at some point online. In this series we had 7 webinars. So today we got our colleagues, which will be introduced very soon, and the next one is on 14th of January, where we got colleagues from China, Professor Fiji Kao and Dr. Vera Nagovi from Tanzania. So with that, I would like to introduce to my colleague, Professor Abigail Bisto, to open this webinar. So Professor Bisto is the head of the Department of Civil and Environmental Engineering at the University of Surrey. She is the United Kingdom Acoustics Network Plus team lead on the future of mobility and co-lead of the Noise and Soundscape Special Interest Group, which is, they call it SIG. Her research is in the transport management and policy, and most notably appraisal of the environmental effects of transport, particularly noise and climate change. So her work on the valuation of transportation noise nuisance has explored aviation and road transport noise in cities across the world, and is now broadening into soundscape assessment. So before I pass on to my colleague, just to give a few the notes that this webinar is being recorded, so you can be available to watch later on. You can put your question answer into this question answer the box, and these will be picked up towards the end of the 2 sessions. So we got 2 webinars, each 20 minutes from our speakers, and I will have to leave actually this a little early today. So my colleague, Professor Abigail Bisto, will take it from here and handle those question answer sessions. So she will read out those question answers to the to our speakers. You can write your name and the location or the country or the place if you want yourself to be named actually with the question. So it's basically your choice. So before further ado, I'm going to pass to my colleague, Professor Araya Asfaw. Over to you.
Great, thank you very much, Prashant. You've obviously given me quite a significant responsibility in taking your place today, so I will do my best. So my role today is really to introduce the speakers and to give them as much time and space as possible, I think. So I will start by introducing the first speaker, who is Professor Araya Asfaw from the University of Addis Ababa in Ethiopia. He's the managing partner of the Sustainability Advisory Group, which provides advice to government and non-governmental organizations and the private sector on sustainability and resiliency. He served as the Dean of Science at Addis Ababa University, where he initiated the Horn of Africa Regional Environment Center and Network. At the moment, he's working as co-PI of the Eastern Africa GeoHealth Hub at the University of Addis Ababa. And he's also working alongside NASA looking at particulate pollution and health in Ethiopia. So over to you, Professor Asfaw.
Thank you very much for the introduction. I will share my screen, if you don't mind. And my talk today is about just to give you a highlight on the state of indoor air pollution and its health effect in Ethiopia. First, let me give you a background about Ethiopia. I'm sure most of you know about it, but I will just highlight some of the, the silent features. So, Ethiopia is one of the second most populous country in Africa, under 50 million people as of 2020. The GDP is 108 billion, and GDP per capita is close to $1,000 per person per year. The CO2 emission per capita is a fraction of 0.149 tons per person per year. When you compare this to China, 7.4, and the US 15, it's almost negligible. But though it is small, the impact of the CO2 emission globally is quite significant. I will share with you some of the NASA simulation that's been done, which basically reflects this phenomena. Is from what you see, two things is, one is the yellow thing that you see coming from Africa is dust, basically associated with desertification of the Sahel. It starts from the Horn of Africa, and then it goes all the way to Sahel. And the dust effect is, as NASA is describing, that the hurricanes that we see that comes to to the Gulf of Mexico actually originates from the Horn of Africa. And because of the desertification of the Sahel, the intensity and the frequency of the hurricanes over the last 40, 50 years has been increasing significantly. The second thing you see below is the green thing is basically black carbon emission associated again with burning of biomass. This has two major contribution of, so to speak, Africa to climate change. Although, as I said, the CO2 emission is small, the impact is huge. Okay. So this comes basically from associated mainly from poverty. And if you look at Ethiopia, in the last 50 years, the population quadrupled. And as a result of that, oh, sorry, sir. I'm sorry. Let me. Yeah.
Is there a problem?
Yeah, I just have some problem with my. Okay, sorry about that. So the as a result of this, huge population increase, what we see here is that, for example, if we look at the, this is what you see here is the northern part of Ethiopia, which is really the water tower of the Blue Nile River. You see a patch of the dots. What you see are a patch of forests that are the remaining forests, resulting from the deforestation, which I just mentioned earlier. And maybe 50 years ago, when the population was not so huge, this whole area was actually covered with, forest. Okay. Again, as I said, this is basically due to, poverty, because of biomass burning. You see that our major source of energy, almost over 90%, comes from fuel wood, charcoal, and dung. Everybody, even kids, go fetching for woods for cooking. And this is really the one that's actually contributing to the, directly to climate change and the pollution. So now there is a global response to that. One of the major global response currently we have is the MAIA initiative. The MAIA initiative is the multi-angle imager for aerosol satellite, which is going to be launched soon, maybe in a year or two. And this satellite will be focusing on the phenomena which I just described, which is basically the cyclotron, the tropical cyclotron, and also the health impact of pollution, particularly emission from black carbon. And to validate the satellite data, a number of instruments are now under construct. I mean, we installing, but gold standard PM monitor, the beta attenuation monitor, and the Aeronet, which is measures basically optical depth of aerosol shapes. And we also have the Spartan instrument, which will be measuring not only actually to identify what the actual source of these emissions are, for example, by doing the chemical analysis. So this is our basically taken in real time, and then we know exactly where the PM, the particulate matter, source comes from, whether it's from biomass or it's from other sources. And we also have the purple air, which is a low-cost monitor, PM monitor, which can be installed, calibrated with a beta attenuation monitor. So to give us a very good understanding of the, the spatial as well as the time distribution of the particulate matter. In the Maya initiative, there are some countries. The one you see in blues are the countries that are primary target countries or cities, and then there are secondary target cities. And Ethiopia and South Africa are the two countries that are considered as the primary target countries. And the instrument that I mentioned to you earlier will be installed in all primary target countries, and then they will really give validate the measurement for the Maya satellite. The basic idea is, the spacecraft validated by this instrument, supported by chemical transport model, and then the health experts will be providing data about, the impact of pollution, especially PM 2.5, which has significant health implications, especially among children. They will provide data, and then by combining these two, we will have a better understanding of the health impact of pollution at a global level. In Addis, we have most of the instruments I just mentioned installed, and then we are currently taking data from that, and especially the low-cost monitors, are very helpful because they can, if they are calibrated with the gold standard beta attenuation monitor, they can give us a very good understanding of the spatial distribution of the PM, the particulate matters. And currently we have installed actually the real time. You can simply browse on your internet and then find out actually what the real time data looks like. And now looking at Addis, we have
yes, I think we're missing these.
So anyway, you can look at the purple air map. It gives you actually what the purple air map looks like globally, especially in Ethiopia, which I just mentioned to you. But actually, some of the data that we have taken over the last.
Ẹ bá ń tún wo ẹjọ́ kò wọlé, èmi ló dẹ̀ fẹ́ kàn báyìí ẹjọ́.
I think there's some problem with the supporting anyway. It's not so important right now, but you could look at this real-time map, any time from your browser. What by the way, the purple air is something that's globally used for this purpose, and so it's actually US EPA and European, it meets both the US EPA and the European standard on particulate matter measurement. Now, over the last 3 years, through the global environmental health program that I've been working on as a co-PI, we have taken measurement of the at one particular at the Addis Ababa University at the Black Lion Hospital. We have monitored this for the last 3 years, and what you see on the top is what actually looks like during the day. So from here you can observe that the WHO standard is below 40 micron per microgram, 40 microgram, standard, and it's way above that, all year round. And this is the ambient air, okay? And so we did that over 3 years. Actually, data were taken at 3 sites with, beta attenuation monitors. This is really what the ambient air looks like in Addis. And we also have taken some measurement with, to measure some of the indoor air pollution status. One of my students did in 2004 is he used, different fuels, biomass, kerosene, and then clean energy such as electricity and natural gas. And you can see on the first graph on the right that as you go from dirty fuel like biomass to cleaner fuel, the emission actually decreases. But overall, what you see there is really that the 24-hour average is way above the WHO standard. And the same thing with different fuels, stoves, because also, sometimes the emission is also related with the stoves. We did that with, the traditional fuel, biomass, which is 3 stone, and then the improved stone with biomass, but, like rocket stove, and also with kerosene, charcoal stoves, and so on and so forth. We see that actually the people that use cleaner fuel and cleaner stove, have less emission. But still, even if they use that, because if your next door neighbor is using, burning charcoal, even if you use cleaner fuel, it doesn't really help. The emission is still quite high. This was done actually at low income neighborhood. Therefore, what we see is that somebody is using electricity, but your next door neighbor is using charcoal or biomass, then the ambient air actually has significant impact. But this is really preliminary studies. But I think the most comprehensive study that was done is, thanks to Professor Kumar, is the CARE Homes, Clean Air Engineering for Homes study, which was done recently. And it's quite astonishing, the results that came out. This is again a comparison of 11 countries, 11 cities globally, what the impact of indoor air pollution would be, at low-income households. So we did this in Ethiopia, in Addis, at a very low-income household. And you see that, the upper graph, you see that the full width half max of that plot is really between, let's say, 25 and 80 micrograms, per meter cube. So again, this is really quite high. And then the median is way above the WHO standard. So this is the kind of study that we really need to validate, to see the impact of air pollution, especially burning of dirty fuels. And here you also see that both the PM2.5 and the PM10 emission for Addis is quite high compared to other countries. Of course, Dakar in is probably the highest. But Addis is, although it's somewhere between, but it's still compared to, it's quite, way above the WHO standard. So we really need to know what the health implication of this would be. And then the poor household, they basically use natural ventilation, and they use charcoal for cooking, and so on and so forth. And that's really because of that we see this kind of high emission in Addis. And actually, as you can see below, Africa next to Southeast Asia has the highest emission. So I'm sure that when this paper is published, it will have a lot of attention, because it's really bringing out a lot of information about what the state of indoor air pollution at the global level is. And I'd like to take this opportunity to thank Professor Kumar for his really leadership to take this program research coming out. So I would really encourage to do this kind of studies, and then also associate this with health impact studies to make it more meaningful, so that we can influence policymakers. At the end of the day, you diagnose the patient, but then what's the solution? So we really need to address, the problem. In Africa, if you really want to address the problem of pollution or climate change, you have to address the problem of poverty. And if you don't do that, there is no other solution. That's what I might think. Thank you.
Thank you so much, Professor Asfaw. That was fascinating. These are the first results I've seen from that multi-country care homes analysis. So that's remarkable to see. It's genuinely amazing job that all the collaborators have done here. Just to remind everybody that we're going to be moving straight on to the next presentation now. So if you do have questions, please put them in the Q&A and we'll pick them up at the end. So I'll move on to introduce our next speakers. So the next speaker is, or rather, we have two speakers next. We have Dr. Francis Abelluding, who is a researcher and president of the Science and Education Development Institute, Akure, Ondo State, Nigeria. His research interests include the use of satellite models, low-cost sensors and apps in the study of air pollution, and especially indoor air pollution. And he'll be presenting alongside Dr. Adedeji Adelodun, who obtained his PhD in applied environmental science in Korea, and is now working for the Federal University of Technology, Akure, Nigeria. And his primary interests are in indoor air quality, which I guess we could have guessed in some ways, but also marine geochemistry, environmental pollution control, and applied materials science. So I'm going to hand over, I'm afraid I can't remember, is it Adedeji who's kicking off this one? Over to you.
Thank you, Professor Bristow. Good afternoon, good morning, good evening, wherever you are, all over the world. Thank you for joining us this evening. For now, Dr. Francis Abulude will introduce the presentation. Thank you.
Thank you very much, Dr. Adelodun. Good afternoon, ladies and gentlemen. This afternoon, we are presenting a joint paper using a joint PowerPoint. I will start, then the second presenter will follow, and I will conclude. The title of our paper is Awareness, Health Impact and Scientific Mitigation Techniques Across Africa. My name is Francis Olawale Abulude, And the other co-presenter is Dr. Adedeji Adelodun of the Federal University of Technology, Akure. Next slide, please. Indoor air quality is on the note that it is influenced by the followings. The first one is concentration of outdoor air pollutants, that is infiltration of pollutants from outdoor. Number 2 point, indoor sources of pollution. Let's say, for example, in the homes, we have different pollutions through cooking, and frying is one of the methods. Pollutions are taken indoor. So painting and pesticides, they also add to the poor quality of indoor in homes. Characteristics of building, that is, if buildings doors and windows are closed, eventually it is going to affect the indoor air quality. And the last one is habits of residents. In a situation where you have chain smokers and where cooking are being done with wood and biomass, definitely it's going to generate the indoor pollution. So for now, globally, automobile, industrial, biogenic, and biomass-borne emissions are infiltrating indoor air quality. According to WHO, 30% of all the commercial buildings suffer significant IQ problem. In 2019, air pollution was responsible for 1.1 million deaths across Africa, and over 50% of these fatalities were associated with indoor pollutants. The common indoor pollutants in Africa are particulate matter of different diameters, gas pollutants such as nitrous oxide,
I think we lost you.
ozone, CO2, indoor formaldehyde. Next slide, please. Hello,
Okay.
next slide. Okay. In this slide, you have the indoor air pollutants and their sources. Let's take, for example, radon. It is the gas of this that is infiltrated into the buildings through soil. And the respirable particulate matter comes from the cooking. Like I've said, frying, is one of the major causes of high elevation of the indoor pollution. So next slide, please. For the awareness, it is on note that researches are carried out just to test the knowledge and awareness of citizens on IAP. Many research publications were reviewed for the case for this presentation. For example, in Nigeria, only 62% of respondents were aware of IAP and its consequences. Also, in another publication in Africa, in Nigeria, out of 384 respondents, 83.9% were aware of IAP and their health consequences. Now, if we move to Ghana, we discover that 85% of the 96 respondents are aware of the exposure to pollution through the smoke from refuse and the burning of biomass. Lastly, in Uganda, we discovered that over 80% of the respondents are aware of the bad health consequences, especially the ones resulting into cough. From this discussion, it shows clearly that African people are aware of
I think we've lost you, Francis.
Yes. Actually, that is his last slide before I take over. So I will just go to the next slide.
That might be best. Yes,
All right.
thank you.
Francis was talking about the awareness of air quality in Africa. So the first question is, why care? Why the fuss about indoor air quality? I'll take my lead from a book, Practical Environmental Analysis by Rodajovic and Bashkin. And this quote is from the introductory section. It says, air is the most important of the vital substances required for life. Human beings can survive for up to a month without food, up to 1 week without water. But deprived of air, they can survive no longer than a couple of minutes. So we can see the significance of good air quality on human health. A recent study on about 9,200 respondents shows that in current years or recent years, we spend about 86 to 90% of our times indoor. And indoor includes our residence, in-car, factory, and subways. And so how clean is your hair? If you spend up to about 90% of your time indoor, and hair is the most significant aspect of life that sustains our existence, then I think indoor air quality is extremely exigent to our living. Now, the reason for high indoor air pollution, like the first presenter, Professor Araya mentioned, poverty is one of the main reasons why we experience low indoor air quality in Africa. Another one is carefree attitude, chain smokers everywhere because of poverty as well. Low quality material building and disposables, cosmetics, and all these day-to-day amenities we use. Most of these materials are made up of low quality. Most of these are made up of low quality materials. Then, fugitive dust. Fugitive dust is a prominent problem in Africa. As you can see, the bottom right corner. Africa is plagued with numerous untarred roads, probably due to corruption. Contracts are awarded for roads to be paved but not paved, and vehicles, pedestrians passing and raising dust, which through convective mixing get into our indoor spaces. Then lack of national, international, or lack of national and local monitoring bodies, and lack of enforcement of international standards, such as that of WHO. These are reasons why we experience high indoor air pollution in Africa. Infants and children, and also expectant mothers, are majorly susceptible to these high pollution rates in our indoor spaces. Children, because of their high metabolic rates and oxygen consumption. And reports have shown, 2021 WHO reports showing that close to 4 million people die prematurely from illness attributed to inefficient cooking practices. Like Professor Araya said also, the use of biomass, charcoal. Okay, use of low cost, low quality material for cooking, such as charcoal, wood, and untreated biomass. These practices have, one way or the other, elevated our indoor air pollution level. And another report in the same year, this year, shows that up to 50% deaths has been attributed to pneumonia among children below 5 years old. And this is attributed to inhalation of particulate matter. Now, Dr. Abulude was talking about the popular indoor air pollutants. He started by mentioning radon. Radon is a radioactive element that's naturally refractory, but it gets emitted from the subsurface through the fittings of our homes, especially showers and latrines. And then when it gets into indoor, it gets kind of stuck and recycled among the residents. And either one is a smoker or not, one is expected to be exposed to about 0.6 times 10 power minus 5 meter cube of radium per year. And the only practice that one can adopt to avoid this kind of cataclysmic scenario is to have an absorbent and it's minimized. And this is another EP recommended levels for radon. Is less than or equal to 4 picocurays per liter. So one should keep this in mind. Now, the one we are mostly used to is carbon monoxide for incomplete combustion from our homes, kerosene stoves, or analog heater. And we know that carbon monoxide has affinity for hemoglobin is 210 times that of oxygen. So acute exposure may lead to dizziness, headache, nausea, while chronic exposure may lead to death. And because usually an average home or low-income home in Africa adopts low-cost cooking technology such as charcoal, wood, or sawdust. So the expectation of exposure to high level of CO2 is unavoidable. And as you can see on this chart, the maximum limit by WHO CO indoor is around 30 to 50 ppm. Any level above this require exigent approach. Now, CO2, this is my favorite, so I did my PhD on this. It's not a toxic gas, it's a component of natural air in the troposphere, but it's a greenhouse gas and it's a major component of our respired air. Being a greenhouse gas, we feel its presence by heat discomfort when we're in an enclosed room with maybe more people. As we respire CO2, it gets warmer and warmer and it will get uncomfortable. Also, its acute exposure can lead to dizziness, headache, and other sick building syndromes. And there are several absorbents for CO2 so that such sick building syndromes could be averted. Pre-industrial era has an atmospheric CO2 level of about 280 ppm. About 20 years ago, it rose to about 3,000 ppm. Now, 10 years later, it rose to about 400 ppm. Due to population explosion, industrialization, and the more flaring of gas and all these antisocial practices, CO2 level keeps rising both indoor and outdoor, and this needs mitigation. Now, there is a research that most tobacco smokers have, in fact, not a research, several research studies have shown that most chain smokers have mental illnesses, either one or two, and they tend to have affinity for such a practice. The advent of electric street cigarettes has not really curbed this addiction, and the worst of it, as you can see in this image in the top right corner, is a woman covering her nose. Is worse for passive second-hand tobacco smokers. That means people in the vicinity of people that smoke. Inhaling such toxic fume from the smoke is as dangerous as the one that is taking it actively. So there's research using GCARE have showed that there are about 7,000 chemicals that can be identified from smoke emissions, as in cigarette smoke emission. And most of them are cancerous. And for this reason, one needs to be careful of the environment he is when around chain smokers because of the deleterious health effects. Now, volatile organic compounds. Look at the right hand side. This image shows that we are all surrounded by sources of VOCs, repellents, perfume, nail varnishes, glue, solvent, all sources of aerosols, right? Even furnitures, even when in our car, the dashboard of our cars, when heated, emits VOC, And all this, when inhaled, impair our health, either mildly or significantly. Signs include irritation of eyes and respiratory tract, nausea, headache, dizziness, and loss of consciousness. And these are, on the left side, are the various standards of one of the most popular VOC in formaldehyde. There are so many studies on formaldehyde in the benzene, toluene, and acetone in our indoor spaces. Now, still talking about, okay, now on particulate matter. Most studies, like when Professor Araya and Dr. Abulude were talking, focus have always been, or most people have always been focusing on PM 2.5 and PM 10. These are particulate matter of sizes less than 2.5 micron and 10 micron respectively. But in the past decade, I'm sure South Korea, China, USA, Belgium, Norway, and Spain, they've been looking at PM1, which is particulate matter of size less than 1 micron. To illustrate the sizes, you can see the image at the right side using a strand of human hair, which on the average is about 10 to 120 micron in diameter. Then PM1 is a typical size of suits of viruses, while PM 2.5 usually found as the combustible particles, metals, and organic compounds such as the VOCs. Then PM10s, particles such as pollens, dust, and mold. All these particles, as best as we can, should be avoided. Now, a typical example is the current situation in a prominent city in Nigeria called Port Harcourt. For the past 3.5 years, there have been this incessant irritating sight of heavy air pollution in Port Harcourt. Initially, no one could attribute it to any cause, but later the source was found, but so far nothing has been done. I was still in Port Harcourt last week, and in the morning I still saw something like this, and people are living like there was nothing. And it bothers me because I'm a air quality expert and seeing this, because the actual effect of inhaling this day in, day out is chronic. Every morning you put your hand in the gas plane, in your car, your window, you get a lot of particulate from it. So a study was done and published 2 years ago in a neighboring city in Yanogwa, and the person carried out a significant and detailed study on PM1, PM2.5, PM4, PM7, and PM10. This is an interesting study I would suggest we look into. Okay, now to mitigate, the best way is to avoid or to reduce from source, and legislations should be made and adhered to and enforced, especially in African countries that have been overlooking the significance of air quality. Now, technological approach. Professor Kuma showed 2 publications made on in-car air filters and the effect indoor in-car air quality. This is an in-car air filter that takes in CO2 and particulates from your car, so you don't need to wind up and wind down intermittently while you're traveling. All the respired CO2 are taken care of. Now, for indoor houses, there are electric indoor air filters, but this require electrical power and constant electric power supply to function, but equipped with filters to take gaseous pollutants and HEPA filter to take care of particulate matter. Or we can have analog replaceable air filter in our vents to ensure that convective mist that comes through our windows and vents are clearly filtered off. However, those technologies are high cost and they are not really accessible or affordable. So for Africa, in Africa, adequate ventilation, because ventilation is suggested for people that can afford air conditioner, can use that and ensure that the filters are replaced and convective mixing is advised. But my favorite is the use of indoor plants. There are several indoor plants that naturally they will take in our rubbish and give us clean oxygen, replenishing the air quality that is good for our health. So we should look up, encouraging our listeners to look up for indoor plants and pick specific ones and have them around your homes. You will actually feel the difference. Now, cross ventilation is the way to ensure that indoor the concentration of air pollutants in these concentrations are frequently diluted. But we have a peculiar case in Africa, and that is malaria. How do we solve malaria dilemma? Now, most average to high income homes have mosquito nets as screens to fade off mosquitoes. But still, opening your door allow these screens, the diameter allow dust to come in easily. So the recent technology is a dust mosquito screen that is actually being sold nowadays that can keep off dust and as well as mosquito. However, because of the pressure drop, after the pressure has accumulated on the screen, it's still, the efficiency is not high. So my current research interest is how to make dry deposition using electrostatic precipitation for high income home that has stable electricity, and the wet deposition whereby you can use the wet scrubber, just water, to enhance the efficiency of this dust mosquito screen. Having this installed, when successful, when funded and successful, homes can be rest assured that leaving their doors open will keep up both mosquitoes and dust. Dr. Abulude will continue and round up this discussion. Thank you.
Yes, correct. Leave it like that.
Thank you, Adedeji. Was there anything else?
Yes, Dr. Abulude should just round up the remaining, I'm not sure it's online, the remaining few slides, 2-3 slides or so.
Dr. Abulude, are you with us? No, unfortunately.
Okay, let me do that. So as you can see this figure on the right, all right, the right side, and the scale is shown on this publication range of 0 to 42. This is the kind of awareness in Africa. You can see Nigeria and South Africa has been leading in terms of publications on indoor air quality. And there are some countries that actually have not shown any kind of awareness at all. And this is alarming because this paper was published February this year. So it is extremely important that the awareness in Africa is made known across board, especially these countries that have not had just a single publication on indoor air quality. And talking about the health effects in terms of death from indoor air pollution, we can see the legend in percentage from no data to 15% data. Zooming in on Africa, the northern part and the southern parts, there are no data, so to speak. But still, we have, in the middle part of the country, we have countries that are responding to providing data on air quality. Now, on the top right corner, premature deaths attributed to causes, different causes: air pollution, water pollution, unsafe sanitization, and childhood. You can see how much premature deaths have taken place from air pollution in Africa. By now, maybe the value, because this data was getting 2013, maybe up to 1 million. So the use of, we need to adopt some technologies on our way forward. Air quality modeling should be encouraged so that we can know which condition we have now, and the benefits and the health impacts should be made known in terms of awareness to people and policymakers, implementing these policymakers, making materials available like these mosquito dust screens, and then substituting low quality, low cost biomass as fuel for biogas. And also, very important, roads should be rehabilitated so that fugitive dust, which is the primary source of particulate matter, will reduce. Also, restriction of outdated vehicles and two-smoke engine mobile should be also truncated. Unfortunately, in most parts of Africa, we rely on road transport. So traffic-related air pollutants are all over the place. So if countries that are buoyant enough to implement subway trains and all this to minimize the number of cars on our way, then such problems on indoor air quality will be cut significantly. These are our references, and I thank you for your time and attention.
That's great. Thank you very much for those insights into problems and challenges in Nigeria. I've got a couple of questions coming up in the Q&A. So the first one is, I believe, for the second speaker, which is about how air conditioners can be considered to be a low-cost option, especially in an African setting where electricity costs are very high.
Thank you so much. Actually, it's true. If you have air conditioner system in your home, you're a rich man. But there is this inverter technology now, whereby air conditioners take up to about just 10% of the initial energy cost. Yeah, the cost price is not up to twice the conventional one, just a little bit high, but the energy required, the power required has been cut down to about 10%. So some people might not be aware of inverter technology. LG is the front runner. I think Samsung has followed suit. So having this and thinking about the eventual cost on taking care of your health and your family's health, then one will know that inverter technology air conditioner is more or less okay. Yeah, for average and high-end family. Yeah.
Yeah. It's a difficult question, isn't it? It's not low cost, but it's a solution that's affordable for some.
Yes.
Is that fair? Or perhaps not a solution, but a partial mitigation measure.
That is why, sorry if I may add, that is why I'm coming up with this current research of mosquito dust screen that one can easily use so that you can keep your windows open and you won't be scared of dust coming in, because it's either you use, if you can afford a small inverter, then we use electrostatic precipitator and the dust are kept off. But if you can't, we use analog, just wet scrubber, and the same results are cheap, but you just need to be changing the water like every 2 days. So this is, if you can't afford air conditioner, you should be able to afford changing about 2 liters of water every day.
Yeah, okay, thank you. Well, that's really interesting, actually. Then there's another question coming up now from William Nelson saying, and this is a more generic question. So it's how the mortality data is linked with air pollution, as there is no such clear category and cause of death as air pollution, even as a secondary cause. And I just wondered if anyone would like to venture an opinion there.
Okay, I haven't carried out such research myself before, but most of these data are from WHO, well-funded, and it spans through a long period of time. For them to have data for acute and chronic conditions. For instance, I worked with a professor in Korea, a very prominent professor on the effects of electric cigarettes. And it carried out as an emission from electric cigarettes, if it actually solved the problem from emission from conventional cigarettes. And it carried out data gathering for almost 15 years. So it's this kind of data is more reliable, and it can give it can indicate what scenario. It's better than not having any data at all. 15-year data gathered from about 10,000 people. Yeah, and all outliers are removed. I think it's better than not having any data.
I mean, I think you're right. A lot of the data get from really large-scale epidemiological studies that look at all the other contributing factors and still come to the conclusion that air pollution is one of the key factors there. I just wondered if I can't see any other questions at the moment, but I did wonder if I could ask Professor Asfaw a quick question about the work for NASA. In that, how is my perhaps naive question, does satellite data link to the particulates on the floor? You know, how do you make that link? Oh, you're on mute.
How do we make a link between the satellite data and what? And
the carbon, sorry, the particulates that you're measuring on the ground.
Oh yeah. Sure. Well, we believe that right now, at least some of the studies indicate that most of the particulate emission, especially PM 2.5, is associated with either biomass burning or diesel from transportation, especially in the city. However, we really have to quantify it more, you know, exactly where it comes from. And so the study from the satellite data, where first of all, we have to validate the satellite data with actual measurement on the ground. For that, what we do is we really make a measurement of the PM emissions, you know, what it looks like, you know, right now we're doing it 100-kilometer radius in Addis, which is the one that's mostly significant. And then we validate that with not only the concentration, but actually where it comes from. The Spartan network, which will be deployed globally, would be used to monitor, you know, fingerprint exactly where the pollution is coming from, whether it's from diesel or biomass burning or so on and so forth. Right. So that will be validated with the satellite measurement. So when the satellite is launched, let's say maybe a year or two from now, then when it maps out the PM emission, especially PM 2.5 and PM 10 globally, we know exactly where the source of the pollution is coming from.
Yeah, that's going to be a fascinating piece of information, I think. So that's going to be one to look forward to. I realise, looking at the time, that we have actually run out of time for the session. So my apologies for that. And also my apologies for some of the technical, minor technical hiccups. But I think we really managed to get the gist of what you were saying all the way through, and the presentations were really informative and really valuable. And I enjoyed them very much, to learn so much. And I look forward to seeing the publication of the GCARE Homes work. As I say, I haven't seen those results before, so it was really interesting to see those. I'm not sure if there are any closing slides, as I'm standing in for Professor Kumar. There are some closing slides. So this is, having thanked our speakers today, we're moving on to January, when we'll be looking at, unfortunately, the continuing topic of our times. So looking at mitigating strategies for COVID-19 infection transmission indoors, which is remains sadly pertinent, and looking at air quality monitoring in Dar es Salaam. So looking forward to seeing you all again in January, when Prashant will be back in charge, and I'm sure there will be absolutely no technical hitches whatsoever with Prashant back at the helm. So thank you, everybody, and I hope you enjoyed these presentations as much as I did. Thank you very much.
Thank you.
I'll say goodbye. Thanks.
Thank you.